Recently, in Malaysia, a cardiothoracic surgeon shared his personal experience on social platforms, highlighting a long-standing and serious shortage of cardiothoracic surgeons in the country. This revelation has sparked a heated discussion about the uneven distribution of medical resources. The unnamed doctor recounted a tragic incident involving a young pregnant woman who was rushed to the hospital with aortic dissection and decompensated heart failure due to mitral valve insufficiency. The hospital had only one cardiothoracic surgeon, who was occupied with other patients at the time. Consequently, the pregnant woman had to wait in the intensive care unit, ICU. Despite her condition remaining stable initially, she ultimately suffered a cardiac arrest and passed away because she could not receive timely surgery. "I had to perform CPR for several hours because I refused to give up," the doctor recalled painfully. "But in the end, I was forced to let go. I couldn't imagine the pain and despair her husband felt when I told him the bad news." This heart-wrenching account underscores the severe shortage of cardiothoracic surgeons in Malaysia. Abdul Jiba, a professor at the University of Sabah and a specialist in the Department of Anesthesiology and Intensive Care, also shared his views on social platforms. He emphasized that similar tragedies are constantly occurring in many hospitals across Malaysia. As the director of the ICU ward, he is deeply affected by these recurring incidents, often feeling powerless and depressed in the face of such dire circumstances. "If we had one more cardiothoracic surgeon, this tragedy might have been avoided," said Dr. Abdul Jiba, urging society to focus more on the training of cardiothoracic surgeons and to increase investment in medical resources to improve patient care conditions. The Faculty of Medicine at University Technology Mara has recently entered the discussion, advocating for the opening of quotas in the Department of Cardiothoracic Surgery to non-Indigenous students to address the surgeon shortage. However, the school responded that the program is currently only open to Indigenous students. This response has sparked widespread attention and debate across various sectors of society. For the Malaysian healthcare system, addressing the shortage of cardiothoracic surgeons is an urgent issue. As the population ages and chronic diseases continue to increase, the demand for cardiothoracic surgeons is growing. Balancing the allocation of medical resources and improving the quality of medical services is a challenge that the Malaysian government and all sectors of society need to confront together.
Tune in every Monday to Friday at 8 p.m. for Qingxiao View, the Business Bridge.